Imagine a headache, not the kind you get after staring at a screen for too long, not the kind you get from dehydration. I'm talking about a pounding, throbbing pressure behind your eyes. It feels like a demon is clawing at the inside of your skull, trying to get out. You are living in the year 1250. There is no Tylenol, there is no aspirin, there is no MRI machine to tell you what is wrong. So, you go to the only person who can help. He is not a doctor in a white coat. He is a man standing in a dusty shop wiping blood off a razor blade. He just finished shaving a man's beard. Now, he turns to you. He tells you the problem is simple. The demon needs a door. And he has just the tool to open it. Welcome to the nightmare of medieval medicine. Today, we are not looking at dusty textbooks. We're going to peel back the skin of history. We're going to step into the blood-soaked shoes of the patients who lived through the impossible. From boring holes in the head, to sticking needles in the eye, to draining the body dry. And the most terrifying part, some of them actually survived. This is the story of how we used to heal, by hurting. Let's go back to that chair. You're sitting down. The man, let's call him the surgeon, hands you a piece of leather. Bite down, he says. There is no anesthesia, no numbing shot. Maybe, if you're lucky, you have had a stiff drink of ale mixed with opium, but mostly you are fully awake. He picks up a tool called a trephine. Ideally, it looks like a corkscrew. He places the metal tip against your forehead, right where the pain is, and he begins to twist. 1 turn, 2 turns. You can hear it. The sound of your own bone being ground away. The vibration travels through your teeth, into your jaw. This procedure is called trepanation. And believe it or not, this is one of the oldest surgical procedures in human history. We have found skulls dating back to the Stone Age, 7,000 years ago, with perfectly round holes bored into them. But in the Middle Ages, this was not just about relieving pressure from a head injury. It was spiritual warfare. If you had epilepsy, if you had migraines, if you heard voices, the diagnosis was often supernatural. An evil spirit was trapped in your grey matter. The only way to cure you was to let the light in. Literally. The surgeon has to be careful. If he drills too shallow, the demon stays. If he drills too deep, he hits the dura mater, the membrane covering your brain. 1 slip, 1 infection, and you are dead in 3 days. But here is the statistic that will blow your mind. Historians have examined thousands of skulls from the medieval period, and they found something impossible. Most of the holes had healed. Look at the edges of the bone. They are smooth, they grew back. That means the patient survived the drilling. They live for years afterwards, walking around with a soft spot on their head, a permanent window into their brain. It creates a terrifying question. If you survived the drill, did the headache actually go away? Or did you just learn to never ever complain about pain again? But the skull was sturdy. It could take a beating. The eyes, however, were a different story. Imagine slowly going blind. A cloudy white film covers your vision. You have cataracts. In the Middle Ages, blindness was a death sentence. You could not work, you could not farm, you became a beggar. So desperation drove people to the cataract specialist. Usually this was a travelling showman. He would set up a stage in the town square. He needed an audience. He didn't have a laser, he had a needle, a long, sharp bronze needle. The procedure was called couching. The assistant would hold your head in a vice-like grip. The doctor would tell you to look towards your nose, and then, without blinking, he would plunge the needle into the white part of your eyeball. He pushes the needle deep inside until it touches the cloudy lens behind your pupil. Think of a grape floating in water. His goal is to knock the grape down. He uses the needle to physically push the cloudy lens down to the bottom of your eye, out of the line of sight. Suddenly, light floods in. The patient screams with joy. I can see! I can see! The crowd cheers. The doctor collects his fee and leaves town immediately. Why does he leave? Because he knows the truth. The lens is still inside the eye. It begins to rot. The immune system attacks it. Within a week, the eye turns red, swells up, and turns into a bag of pus. Most patients went permanently blind. Many died from the infection spreading to the brain. But for that one moment, they saw the world. If the eye doctor didn't blind you, the dentist might kill you. Let's talk about the most common pain of the era, the toothache. Medieval people didn't eat much sugar, but their bread was full of grit and sand from the millstones. It acted like sandpaper, grinding their teeth down to the nerves. But they didn't blame the bread. They blamed the toothworm. They believed a tiny, evil worm had burrowed into the tooth and was thrashing around. That was the throbbing pain. So, how do you kill the worm? You burn it out. They would take a red-hot wire, dip it in acid, and jam it directly into the cavity. If that failed, they called the tooth drawer. He didn't have a chair. He sat you on the floor, clamped your head between his knees, took a pair of pliers used for pulling nails out of horseshoes, and twisted. No numbing, just brute force. And often they would pull out a piece of the jawbone along with the tooth. Infections from dental work were a leading cause of death. Even Queen Elizabeth I was so terrified of them, she let her teeth rot until they were black. Now, you might be wondering, who were these butchers? Who are these people performing brain surgery and eye stabbing in rooms with dirt floors? They were not educated at universities. The university men, the physicians, were too busy reading Latin and studying the stars. They thought surgery was dirty work, manual labour, beneath them. So, the knife fell to the barbers. Yes, the same guy who trimmed your moustache was the guy amputating your leg. They were known as the Barber-Surgeons. They were the working-class heroes of healthcare. They were fast, they were brutal, and they had the sharpest blades in town. Have you ever looked at a barber pole outside a shop today? That spinning cylinder of red and white? It is not just a cute decoration. It is a bloody history lesson. The white stripe, that represents the bandages. The red stripe, that is the blood. And the pole itself, that represents the stick the patient would grip tightly during the procedure, so they would not scream and thrash around while their veins were being cut open. After the surgery, the barber would wash the bandages and hang them outside on a pole to dry. The wind would twist them together, red and white spiralling in the breeze. That is the origin of the symbol we see on every street corner in America today. We are literally advertising medieval torture as a sign of grooming. But the Barber-Surgeons had one enemy they feared above all else: the stone. Bladder stones were incredibly common back then due to bad diet. Imagine trying to pee, but a jagged rock is blocking the exit. The pain was excruciating. Men would beg for death. So they underwent the lithotomy. This is without a doubt the most painful operation in human history. 4 men hold the patient down. His legs are tied up to his neck. The surgeon inserts 2 fingers into the rectum to feel for the stone. Then he takes a knife and cuts into the perineum, the sensitive area between the legs. He cuts deep until he hits the bladder. Then he inserts a pair of forceps, like salad tongs, into the wound. He rummages around, grabs the stone and rips it out. The mortality rate was 50%. If you didn't die from blood loss on the table, you died from gangrene a week later. And yet, people lined up for it. That is how bad the pain was. But how did they decide which surgery you needed? They didn't have x-rays, they didn't have blood tests, they had urine. Welcome to the golden age of the piss prophets. Doctors carried around a chart called the urine wheel. It had 20 different colours of pee, ranging from clear to black. They would look at your urine, they would smell it, and yes, they would taste it. If it was sweet, you had diabetes. If it was foamy, kidney issues. This was the primary diagnostic tool for 1,000 years. A doctor's reputation was built on his palate for human waste. But why? Why all this cutting, drilling, and tasting? It was not just sadism, it was a philosophy. Medieval medicine was ruled by a ghost, a Greek ghost named Galen. He lived 1,000 years before the medieval era, but his word was law. Galen taught that the human body was like a container filled with 4 fluids. He called them the humours: blood, phlegm, yellow bile, and black bile. If you were healthy, your fluids were balanced. Perfect harmony. But if you got sick, it meant you had too much of one fluid. Have a fever, you have too much blood. It is hot and wet. You need to get rid of it. Depressed, you have too much black bile. Angry, that is yellow bile. It sounds ridiculous to us in the year 2026, but think about it. When you have a flu, your nose runs. That is phlegm. When you cut yourself, you bleed. To the medieval mind, sickness was a plumbing problem. The pipes were clogged, the tank was overflowing, so the barber surgeon was basically a plumber for the human body. And his favourite method of unclogging the pipes? Opening a vein. They called it phlebotomy, or bloodletting. It was the cure-all, the aspirin of the Dark Ages. Headache? Bleed them. Indigestion? Bleed them. Broken leg? Bleed them just in case. They believed that by draining the bad blood, the body would naturally restore balance. It was elegant, it was logical, and it was completely deadly. Imagine you're already weak from an infection. Your immune system is fighting for its life. And then, a man comes in and drains 2 pints of your blood into a bowl. He is literally draining your life force while telling you he is saving you. George Washington, the first president of the United States, died in 1799. Do you know how? He had a throat infection. His doctors, the best in the country, bled him. They took 40% of his blood in 12 hours. They bled him until his heart stopped. That was the legacy of the medieval mind. It lasted for centuries. But sometimes, the knife was too dangerous. Sometimes, the location was too delicate for a blade. The eyes, the gums, the genitals. You could not just slice those open. So nature provided a tool, a living tool, a monster that lives in the mud. Prepare yourself, because what comes next is going to make your skin crawl. We are leaving the barber's chair. We're going down to the river. We're going to meet the creatures that became the most valuable medical device in history. They have 3 jaws, 300 teeth, and an unquenchable thirst for human blood. Welcome to the pharmacy of the Middle Ages. It is not a sterile room, it is a swamp. And the person collecting the medicine, she is not a scientist, she is usually a poor woman, a peasant. She has no nets, she has no traps, she has only one way to catch the product. She hikes up her skirt, she wades into the freezing mud, and she waits. She is the bait. She waits for the feeling of sharp, tiny needles piercing her skin. 10 minutes later, she walks out. Her legs are covered in black slugs, gorged on her own blood. She peels them off, salts them, and sells them for a few pennies. This was the supply chain of the Hirudo medicinalis, the European medical leech. We call it the Leech Craze. It sounds like a joke, but the numbers are staggering. In the year 1833, France imported 42 million leeches. Think about that number. 42 million. They were used for everything. If you had a sore throat, a leech on the neck. Hemorrhoids? 5 leeches, right on the source. Mental illness? They would shave your head and cover your scalp with them like a living, breathing hat. Let us look at the engineering of a leech. It does not just bite, it saws. It has 3 jaws, arranged in a triangle like the Mercedes-Benz logo. Each jaw has 100 teeth. That is 300 teeth working in unison to slice through your skin. But you do not feel it. Why? Because the leech is also an anesthesiologist. Its saliva contains a powerful numbing agent. You do not feel the bite until it is already feeding. And it contains something else. Hirudin. It is one of the most powerful anticoagulants on Earth. It stops your blood from clotting. It turns your veins into a free-flowing tap. The doctor would see the blood soaking the bedsheets and say, "Excellent! The evil is leaving the body." But the evil was not leaving. Something much darker was arriving. The year is 1347. Ships arrive in Italy carrying rats, and on the rats are fleas, and inside the fleas is the apocalypse, the Black Death. In 5 years, it will kill 50 million people, 60% of Europe's population. Gone. Enter the most terrifying figure in medical history, the plague doctor. Look at him. He looks like a bird of prey sent from hell. But believe it or not, this was a hazmat suit, the long wax coat, to stop bodily fluids from sticking to him, the stick, to poke bodies without touching them, and the mask, the famous beak. It wasn't for fashion, it was a gas mask. They believed the plague was spread by miasma, bad air, so they stuffed the beak with 55 different herbs, rose petals, carnations, laudanum, and camphor. They thought if they smelled flowers, they wouldn't die. Imagine looking up from your deathbed. You're rotting alive, and the last thing you see is a giant leather bird staring down at you. He doesn't have a cure, he's just there to count you. When the masks failed, when the leeches failed, humanity broke. People realised medicine couldn't save them. They decided this wasn't a disease, it was a punishment from God, and if God was angry, he needed blood. They were called the Flagellants. Thousands of men marching from town to town chanting hymns. They carried heavy leather whips with metal spikes at the end, and with every step they lashed their own backs. Snap, snap, snap. Blood splashed onto the dirty streets. The crowds watched in awe. They dipped cloths in the blood, thinking it was holy. They thought that by torturing themselves they could convince God to stop the plague. It was mass hysteria. A suicide pact disguised as religion. And ironically, by moving from town to town, bleeding everywhere, they were actually spreading the plague faster than the rats. The Middle Ages ended not because they found a cure, but because almost everyone who could die, died. So we look back at them. The drilled skulls, the blinded eyes, the bodies ravaged by leeches and whips. It is a horror story, but it is also our story. Every scar on their bodies brought a lesson for ours. And before you laugh at their stupidity, remember one thing. In the year 2004, the United States government officially approved the use of leeches in modern microsurgery. Yes, the monsters in the mud are still with us. The tools change, the fear changes, but the goal remains the same: to survive, to stop the pain, to live one more day. If you have the stomach for more dark history, hit the subscribe button and tell me in the comments, if you lived in 1347, would you trust the doctor with the beak? Or the man with the whip? I will see you in the shadows.